Hello, my dear friend students. This is a session of practical implementation of thoracic drainage. I'm going to show you what the thoracic drains look like, what does the drainage bottle look like, and a thoracic drain in a surgically operated patient yesterday. The thoracic drains are plastic tubes with a metal guidance which is inserted inside, and they come in various shapes and sizes, and they are packed in these plastic bags, and before we put them in we have to again take them out. And as I said, there are different forms of drainage. Some of them do come without this metal rod, and besides we have a drainage double sealed bottle which is connected to the drains and can be put on active suction. This is a pretty sophisticated box which can also measure the amount of fluid coming out. This is a little baby of 2.3 kilos who was operated yesterday for a sophisticated cardiac procedure, and the thoracic drains were placed intraoperatively through the midline. This is slightly different from the thoracic drainage we use in other situations like pneumothorax or thoracic operations where we put the drain from the side. After inserting the drains, it's obligatory to check the position of the drains on the chest X-ray. We can see that this patient over here has 3 thoracic drains, 2 bilateral, or one left and one right, and one retrosternal. This patient has 2 drains, one retrosternal and one lateral. All the drains have radio-opaque lines which help us see where the position of the drain is. Correct positioning of the thoracic drain in cases of pneumothorax or pleural effusion and non-cardiac operations is the mid-axillary line. This is an imaginary line which goes through the middle of axilla, and the correct position of the thorax is in the 5th intercostal space. It is very important to position the thoracic drain in the right position. If we go too high up, we can damage the breast, especially in younger girls or babies, and after that with growth we'll have a very unfortunate scar. If we position the drain behind, it will be very uncomfortable to have the patient laying down. In the case of thoracocentesis in small children, the proper position or the proper place to insert a drain or puncture is the mid-clavicular line in the 2nd intercostal space.